This week's Ask Dr. Durie comes from a patient who has had myeloma for over 10 years and about a year ago was started on daratumumab, Darzalex, when the myeloma relapsed. The Darzalex worked well for this past year, but now the myeloma is relapsing again. And so the question is, what to do now? Well, this has become an increasingly important question as we've been using more and more of the Darzalex, the new anti-CD38 monoclonal antibody, in this kind of a relapse setting. And we've learned quite a few new things. So first of all, we know that if you're using the Darzalex as a maintenance, for example, once a month, then the myeloma can sometimes start to progress. However, if you go back to a once a week or twice a month schedule, you may recover or regain control of the myeloma. In addition, one could add in a second drug along with the Darzalex, and one very active combination is the combination of Darzalex with pomalidomide plus dexamethasone. And in this case, the combination has been approved by the FDA as a relapse treatment because it is strongly active in this sort of a relapse setting. And so increasing the frequency or the dose, using a combination, combining with a variety of other drugs which may have worked well in the past, all of these different things can have a good impact and extend or recover the remission. In addition, in a situation like this, if transplant has been used in the past, it could be that considering a second transplant could be a way to have a decisive additional response, which could be well sustained. And so the main thing is that even in this relapse setting, there can still be an opportunity to seek and to achieve a longer lasting remission. And so bottom line, very important to talk to your doctor and discuss all these options carefully. Maybe you need to even get a second opinion. You need to think about, well, what about the possibility of a new drug, even one of these exciting new therapies like the CAR T-cell therapies, and those can also be considered. One of the problems in these kinds of clinical trials is that there can be a delay in getting into these CAR T trials, for example, because there are long waiting lists. And so there must be a balance between your immediate need to get therapy, the convenience of actually getting treatment just close to home through your own doctor, or seeking out something much more experimental, which could be helpful, but really in the setting of where the other treatments have failed or are stopping working well. So a lot of things to think about, but the main thing is that many options could be considered and many could end up continuing to do an excellent job.